How to manage hydroxyurea dosage for sickle cell. Managing hydroxyurea dosage for sickle cell disease is crucial for effective treatment. It starts with a carefully determined initial dose based on the patient's age and weight. For adults, the typical starting dose is 15 milligrams per kilogram of body weight per day. This dose is rounded to the nearest available capsule strength, which is usually 500 milligram capsules. For children and infants, the initial dose is generally higher, around 20 milligrams per kilogram per day, given as a single daily dose. If a patient has chronic kidney disease, a lower starting dose of 5 to 10 milligrams per kilogram per day may be necessary. This medication is usually taken once daily to help with adherence and improve how the body absorbs it. Once the initial dose is established, dose escalation can begin. The dose can be increased by increments of about 5 milligrams per kilogram every 8 to 12 weeks, depending on the patient's clinical response and tolerance to the medication. The goal is to reach the maximum tolerated dose, which is the highest dose that does not cause unacceptable side effects, particularly bone marrow suppression. The maximum daily dose should not exceed 35 milligrams per kilogram or 2,000 milligrams per day. Regular monitoring is essential during treatment. This includes complete blood counts with differential and reticulocyte counts to detect any issues with bone marrow suppression or low blood cell counts. Liver and kidney function tests should also be checked periodically. Hemoglobin F levels may be measured to assess how well the treatment is working, as hydroxyurea increases hemoglobin F, which helps reduce sickling of red blood cells. For patients of reproductive age, pregnancy testing and counseling about contraception are important due to the potential risks associated with the medication. If blood counts fall below safe levels, such as in cases of neutropenia or thrombocytopenia, the hydroxyurea dose should be reduced or temporarily withheld until recovery occurs. Adjustments may also be necessary based on side effects, kidney function, or other clinical factors. When managed properly, hydroxyurea therapy can significantly reduce the frequency of painful crises, acute chest syndrome, hospitalizations, and the need for blood transfusions. To improve patient adherence, it is beneficial to administer the entire daily dose once daily instead of splitting it into multiple doses. Using fixed capsule sizes can simplify dosing and help ensure consistent daily intake. In summary, hydroxyurea dosing for sickle cell disease starts at 15 to 20 milligrams per kilogram per day. This dose is gradually adjusted upward to the maximum tolerated dose with close clinical and laboratory monitoring. This careful approach requires individualized management by healthcare professionals experienced in treating sickle cell disease to optimize benefits and minimize risks. Always consult a healthcare professional for personalized medical advice.